So what I would like to know is from both of you, so we can start with acupuncture. I want to know what kind of patients you do acupuncture on, what kind of, what are some diagnoses you might treat. I want to know how many needles you use. I want to know how long does the needle stay in? Do you leave the room while the needle's in? Those type of things. Those are the same questions I want to ask, so I can just see what is an actual, I arrive at your doorstep, what are you going to do to me?
We have a bunch of acupuncturists in the audience right now. Will you raise your hands? Okay, are we all the same? No.
Okay.
All right. So the most important thing is that every single acupuncturist is trained in America is trained in modern techniques as well as traditional Oriental medical techniques. So if we had a situation where somebody had a muscle that was spastic and it was practically a trigger point, we call it not one, but it's a trigger point, we would do the exact same technique that the physical therapists do in dry needling. Okay, we would put the needle in, we would find that spot that is tight and taut, and we would work the needle to relax it, and it would relax. It's exactly the same thing that PT dry needling is. Okay, so the problem that they're saying is that what we do isn't what they do, but the thing is they only do this tiny little part of what we already do, and we've been doing it a lot longer. And then all the rest of the acupuncture, which of course they really aren't legally able to do, is much more. But the fact is that I was trained from my first clinicals to do that technique. It's called the lifting and thrusting. It's into an osseous point. We were taught it was a trigger point because that was the nomenclature that we've been using in the modern time. And so it's the same thing. So they are doing what we're doing. And we're the ones that did it first in this country. And they know that because that's actually who taught them, is acupuncture.
Okay. Erin, did you have
Well, I just want to follow. I don't know that you fully answered the question. So how long? Let's say it's a strained thigh. Okay, so hamstring. So everybody's answering the same question. How long are they there? How many needles? How long are the needles in?
It depends on the tolerance of the patient in the moment, but the truth is that we will needle into that muscle that is taut, just like it's a trigger point, an osseous point. In addition, we will do other things because we have extra expertise, and so we will add to that. And that is actually such as putting needles in their ear, putting needles in their hands and feet. Now, one of our problems with PT dry needling right now is that it is moving away from just trigger points. And if you go online, you're going to see, in fact, I entered into evidence, those PT courses, they're teaching people how to do distal acupuncture points as dry needling. Okay? They're doing facelift acupuncture and calling it dry needling.
Okay, so let's go back to the question again.
Well, that's the answer.
What do you do for this patient who's walking the door with a strained hamstring?
I usually evaluate them, make sure that they're actually, talk to them about what the causes of it are. Usually ask them if they had other therapy and if they've had physical therapy. So then when we put them face down on the table, in that case, then we're going to go ahead and treat their points distally as well as locally and do the very similar technique of going in there, finding that muscle, and relaxing that muscle.
Okay. Is there anything else besides the needling that happens?
It depends on the case. We might have some heat therapy, and we might have dietary therapy. We might talk to them about whether or not they're actually sitting sedentary at their desk and so forth. So we actually do have in not only our training, but the fact is we practice medicine like most practitioners. We got to get to the root cause of this person. So yes, there's a lot of variety.
And I'll speak to that as a practicing physical therapist. I would say the last comment is exactly what we would do. So we try to find the root cause, and from a physical therapist perspective, we're looking for movement-related dysfunctions, analyzing their gait, analyzing their movement, finding causative factors that are causing that strain or may have resulted in that strain. If we do identify trigger points within the area as part of their impairment-based diagnosis, and decide that trigger point needling is appropriate, we'll inform the patient about that, describe them the risks, the benefits, get their informed consent, and apply the procedure, which is a very similar technique as was described. We identify the trigger point, find the right size of needle for the depth of the tissue that we're trying to identify based on our extensive training in anatomy, and apply the technique, primarily trying to elicit a twitch response, but using a pistoning technique in order to identify the trigger points. I would say in the hamstring case scenario, it could be one needle, one area. It could be maybe 2 or 3, probably not much more than that in my experience. If there's different trigger points along the different areas, it also depends on whether it's only the medial hamstring versus lateral hamstring, and the extent of it. Hamstring injuries can be very proximal, they can be mid-portion, so there's maybe different portions we might be treating. Once we're done then, typically we complement that with some further hands-on treatment, addressing pelvic dysfunction, doing anything we do from a manual perspective to facilitate the recovery of that injured tissue. Add in a home program, then they're going to be doing primarily stretching, but we may also have to do some muscle retraining and muscle performance training along with that as well, and addressing any other contributing factors. So is it related to running mechanics, is it related to walking mechanics, is it related to they're doing their yoga, and addressing that, send them home with a home program. Part of the informed consent process is also what to expect. So if you expect some soreness, what to do about that. If you get some bruising, some of that can be expected as per the adverse preventive reports that we see.
So how many minutes would that needle be in that thigh?
Seconds.
Seconds
So
for
I would
you.
say each time maybe 30 seconds at most.
Okay, and for you, how long will that needle be in that muscle?
It depends on the acupuncturist. Myself, it really depends also on the tolerance of the patient, because when you do trigger point therapy, it can be very painful for that, because the muscle can spasm if you don't stop moving the needle. So we usually would take those out. And to be honest with you, there are 2,000 years of acupuncture history, so every practitioner is going to be different. And I would say the same thing about Shane in terms of his PT. That's not what we see overall when we look at the actual PTs doing dry needling. There are pictures that were sent to you of electrostim coming into the acupuncture needles, along with the names of the acupuncture points written on them by a PT that's advertising online. And the other part that actually would be very important is everything else that he said that he does is fabulous. That's why we love our PTs. But you answer what else I might do. If I'm not getting a result with an acupuncture needle, and especially let's say a shoulder or back or whatever, where there's a lot of weakness, there's a lot of atrophy, there's definitely tightness, I actually refer to physical therapists. I have a great relationship in this town with physical therapists. So what happens is I'm not going to do physical therapy. I'm legally able to. It says in my license law I can legally do oriental-based physical therapy. But I don't, because number one, I'm not the expert in that. I want to send my patients to the expert. And they should actually be thinking the same thing about the use of acupuncture. Because that point that he's needling and having to take out, we have all those other tools in our toolbox. And so we might actually find that the reason that the hamstring is tight is because they're actually not drinking the right kind of fluids, and we're going to educate them from oriental medical perspective. And so we don't need to needle them 4 or 5 times in that same spot. We can actually teach them something about our ancient medicine that actually changes their behavior. And they would actually be doing the same thing in a musculoskeletal sense. But we're not just oriental medicine. We actually know a lot of Western anatomy and physiology.